Answer with Dan Proft and Amy Jacobson on AM.
That a much greater percentage of the population than is identified through antibody testing may have developed immunity to COVID-19 through having other illnesses. There was an additional study out of Scripps Research Center in La Jolla, California, that suggests the same. And yet this continues to be dismissed by the deified epidemiologists and infectious disease experts like Tony Fauci. Don't understand it. Sunetra Gupta is an epidemiologist in Oxford. She's one of the apostates, along with Scott Atlas and Martin Kulldorff and John Ioannidis and a number of others. She says the COVID isolation strategies are accompanied by a lot of virtue signaling and self-righteousness, but the costs are very high on the poor around the world as well as the young. I find it intolerable for teachers to ask youth to give up this important phase of their development and to slow the development of herd immunity. If we really care about the common good and protecting the vulnerable, the rest of us should be willing to take a very small personal risk. Yeah, that would be treated as advocating human experimentation. That would be treated as the rhetoric of Dr. Mengele if anybody in the D.C. press corps got wind of it. Thankfully, they don't read. They just recite the talking points they're given from favored individuals. John Tierney does, and he is the one who interviewed Sunetra Gupta, a citation I'm reading from his piece in City Journal. As always, excellent piece, The Moral Case for Reopening Schools Without Masks. And he leans on the views of Sunetra Gupta in laying out the case, including some comparisons and some context to the dismissals of models like Sweden that are not popularized. You're able to dismiss what Sweden did by saying, oh, well, look at the other Nordic countries. This is what Tony Fauci did in his exchange with Rand Paul last week. Look at the other Nordic countries around Sweden, and they have much lower case fatality rates.
Not true.
It is true, but that's not the point. The point is you have to look at all contextual factors. You don't just isolate that single statistic without context, because then you derive no consequence from it. And that's what John Tierney does. John Tierney is a contributing editor to the City Journal, former reporter and columnist at the New York Times. I don't think he'd be welcome in the New York Times anymore. Co-author of the new book, The Power of Bad, How the Negativity Effect Rules Us and How We Can Rule It. John Tierney, thanks for joining us. Appreciate it.
Thanks for inviting me, Dan.
I assume you're about as welcome at the New York Times as another former columnist named Joel Kotkin is these days. But
Yeah.
that notwithstanding, the moral case for reopening schools without masks, I sort of provided Professor Gupta's summation, but give us the evidentiary basis on which he makes that conclusion.
Well, the whole model for the lockdowns and everything was based on the idea that the virus had just arrived and that it was really lethal, and that it was going to lead to 2 million deaths in the U.S. There was one estimate, that the scientists in the New York Times published a thing that 10 million Americans would die because everybody was liable to be infected and it had a really high fatality rate. But that's not what happened. Those models were wrong. And from the very start, Professor Gupta was saying, look, these models could be wrong because actually this virus has actually been here longer. It's been spreading a lot more, and it kills some people, but a lot of people basically are resistant to it. And it's looking more and more as if that is the case. And Sweden is a great case. You mentioned the fact that Dr. Fauci pointed to them, so again in his exchange with Rand Paul. Well, throughout the spring and summer was always Sweden is the cautionary tale. You got to have lockdowns, but look what happened in Sweden, because they did have a very high rate at first. And partly because they didn't do a great job with their nursing homes, although certainly not as bad a job as New York did. But what actually happened was that as the summer went on, then, Sweden had this high hit, and then it went down way below, and the rate has been down close to zero now, since the end of July, the rate of deaths. And now the United States has surpassed Sweden in the number of deaths per capita. So suddenly, and that's what Rand Paul was saying to Fauci. Well, why is that? And then Fauci, I was saying, well, look at the Nordic countries. But in fact, the reason the other Nordic countries had pretty light lockdowns. They were fairly light, and they were also fairly short. They're nothing at all like like the stuff we have here in New York. And Sweden did do worse than them, but there were other reasons for that. It was that Sweden has more immigrants, and one of the main things was that Sweden had a lot of people in nursing homes who were exceptionally vulnerable. And this is the theory that I'm kind of exploring now. Dan Klein, an economist, looked at it. It's called the dry tinder theory. And that if you look at countries in Europe that were hard hit, we like to try and pretend that these are due to their policies. But in fact, what happened was in some countries there were very mild flu seasons the last couple of years. And so you had more elderly people survive them, and they're more vulnerable to the virus this year. And that seems to have been the main difference between Sweden and its neighbors. And they had.
I'm sorry to interrupt, but just for point of emphasis too, because this is important, because this dismissal that Fauci gave that a lot of people do. Norway and Finland, schools reopened in May, bars and restaurants reopened in early June. So just to put a specifics to your point about that, they even Norway and Finland had light touches. They were not following, the CDC, Tony Fauci, Bob Redfield, and lockdown governors and mayors in this country protocol when it comes to schooling and when it comes to restaurants and bars and the like.
Right. So Fauci is telling Rand Paul, look, Norway and Sweden, Norway did better, but Norway's not following his advice. They did better by not following his advice. And what happened over there was Sweden, before any of the lockdowns, Sweden was much harder hit than them, simply because of those factors I mentioned. It had a lot more vulnerable people to it than there. And, other countries like Germany were, Hungary, for instance, interesting study that, Hungary was, very few deaths there. And it's not that they had genius public, health policy there. They had very heavy, mortality in previous years due to flu. So there weren't that many people there to be exposed. So, but when you look at all this data, you talk about, people get accused of, this is human experimentation, to end the lockdowns. I look at it the other way. In fact, I'm doing another piece for City Journal now on that. These lockdowns are human experimentation.
Yep.
This is an unprecedented experiment on the public. And, and by all indications, the number of lives lost, the number of lives ruined, the suffering is far greater than the benefits.
And you mentioned in your piece that for American children under 14, the risk of dying from COVID is actually lower than the risk of dying from the flu or pneumonia.
Right. And for teenagers and young adults, you are much less likely to die from COVID than you are to be murdered. And for anyone under 55, you're more likely to die in an accident or from cancer or heart disease. And this is Gupta's point that these are unless you have a comorbidity, unless you're elderly, unless you're at risk, this virus is not that dangerous. And by exposing yourself to it, people like to take the high moral high ground. Oh, I'm wearing the mask. I'm doing everything to protect everyone else. In fact, if you expose yourself to it and get over it, you are helping to build up herd immunity. And so actually the people who are doing this are the ones who ought to be, who are the real virtuous ones, as opposed to virtue signaling. And, instead of expelling students for fraternizing, we should be praising them. They're doing a social good by building up this herd immunity. All these things about, oh my God, 19 students at this college tested positive and this. If you look at what actually happened there, yes, there were cases, but, nobody's going to the hospital, nobody's dying. And, and they're building up herd immunity, which ultimately helps, elderly people because, the more people are immune to it, the virus stops spreading. It's a fantasy that we're going to beat this virus, that it's just going to disappear. Even with a vaccine, it's going to be like a flu virus. It will remain endemic in the population, but it won't spread very much because most people will be immune to it. And the sooner we get there, the better for everyone.
We're going to beat death altogether, John. That's what I understand. This is
California's staying locked down until they discover a cure for death.
No death, right? Fountain of youth or no schools, period. Here's the thing. The reporting on this is so irresponsible. I know that's axiomatic, but even this blaring headlines yesterday into today, passing the 1 million person dead mark globally. Yes, that's terrible. I mean, nobody thinks anything different than that's terrible. That's unfortunate. It's also unfortunate that 150,000 people die a day in this world. It's also unfortunate that 251,000 adults die in the United States every year from preventable medical error. I mean, there's a lot of things that are terrible. The why we react to this in such a way that is so starkly different from how we react to everything else is the real question that those who favor these policies that are so much performance art don't want to answer.
Right. It's just become a fixation. You know, the deaths with the media, all the media cares about is the number of deaths. And even though that has come way down, now they just focus on the number of cases, even though a few people are dying. It's just become this scorecard that the media takes. And politicians, in their usual way, they just don't want anything bad to happen right now before the next election. So they're just trying to keep those numbers down while destroying so many lives and businesses, while ruining things, while setting up so many more deaths in the future.
Yeah, but I got to say too, I think there needs to be some sort of inventory here, and people need to start really pressing other people on this question. We don't treat. I mean, look, death is part of life, and I'm sorry that people die, but it happens, and so whatever. Get used to it. I don't know what to tell you, but the idea that we treat an 85-year-old who's lived a life and had a great life, and he's at the end of his life and he gets COVID and he dies. I'm sorry that happened. That we treat that the same way. Well, we treat that as a more serious occurrence actually than we treat a 13-year-old who commits suicide. That's a cultural sickness that is with us now, where we don't make any rational calculations about days of life lost, about quality of life, even though we know as a matter of course, we know this, but we're pretending we don't know this. We treat a 10-year-old murdered on the streets of Chicago as a much more significant tragedy than a 45-year-old in the same circumstance. Why? Because it is a more significant tragedy, because the potential that was lost with that 10-year-old is greater, generally speaking, than the potential that was lost with the 45-year-old or the 85-year-old. But we can't even have that conversation now because that's somehow ghoulish or macabre, because I want to pretend that death doesn't exist.
Right. You know what's so disappointing, too, is that the public health profession, I understand why the public has a hard time and they fixate on any one death, and the media does it because it attracts people's attention. But people in the business are supposed to be, thinking about this rationally. And as you say, they have this measure about the quality of life years lost. And they use that when they, evaluate a new drug or something else. How many, years is this? How much good will this do? Well, it's much more important to save the lives of young children than it is to extend the life of someone who's 85 by a few months. So they're supposed to be making this kind of calculation. This is the kind of thing Fauci is supposed to be doing as a professional.
And
Dr. Fauci is
they make that in we make that in civil litigation all the time. If somebody's injured or somebody get back to my medical error, somebody is a victim of a medical error, we make that determination all the time in terms of the amount of working life they had left and what they were making. So we make those economic decisions all the time, and we pretend like we don't now with this.
All right, and then Fauci says things like it's totally unacceptable death to allow herd immunity. I mean, he's not making any calculation. I mean, he's not looking at all the other deaths that will be, there'll be more life years lost from these lockdowns than there will be from COVID, and yet all he's focused on is COVID, because that's his, he's taking responsibility for that. It puts him in the spotlight, and he doesn't want to get blamed for any extra deaths. But he's supposed to be, our professionals are supposed to look at the big picture and make a rational assessment what's good for society. And they've just really, to me, it's an unethical experiment that they're continuing right now with these lockdowns.
John Tierney, pick up his book, How the Negativity Effect Rules Us and How We Can Rule It. Also check out his column, which I tweeted out, The Moral Case for Reopening Schools Without Masks. John Tierney, contributing editor to the City Journal, former reporter and columnist for the New York Times. John, thanks for joining us. Appreciate it.
Thank you, Dan.
Thanks. And he joined us on our turnkey.pro answer line.
This is Chicago's Morning Answer.
Your show keeps me alive during the week.